Good morning. I know we just stand between you guys and lunch. But anyway, we're looking forward to sharing information about our Texas Grow, Eat, Go project. We've been using family-focused interventions, and I'll share a little bit about those interventions. And we are focused on decreasing child obesity in Title I schools. So let's look at a few things. You can see our partnership is just pretty amazing. Texas A&M and the Texas AgriLife Extension Service is the lead agency, but we're working across our research partners at the Texas A&M University, as well as our School of Public Health. And in addition, we're working with a former competitor in the sports world, the University of Texas, and their School of Public Health and the Dell Center for Healthy Living in Austin. These are the partners. I'm going to be sharing the Cohort 1 preliminary results, and you can see we have a huge team. From Extension, we have people who are Extension specialists in horticulture, in nutrition, in health, and in, behavioral science. And we have people from the University of Texas School of Public Health, Sandra Evans, Deanna Holscher, a great statistician, Nalini Ranjit, Carolyn Smith, who works with school data collection for a number of statewide studies, and that's a pretty big job in Texas. Texas A&M, we have a nutritional sociologist, just telling you about the diversity of our team, because it's not just a unidimensional team. We have a psychologist who is a cultural specialist, as well as a couple of people from School of Public Health, Marcia Ori, who worked for the National Institute of Aging and has done a lot of work with environmental issues related to obesity, as well as with aging best practices. So what we're going to talk about today is the overall goal of our study. I'd like to spend just a little time talking about the interventions that we're using. Then we'll look at methods, instrumentation, and then we'll look at some of our preliminary data from Cohort 1, from our child survey, and also from our parent survey, as well as our BMI measurements and biometric measurements. So overall, we started out looking at where we had some assets. The coordinated school health programs, how many of you are familiar with coordinated school health? These programs take more of an environmental approach to the school. They look at the school as the heart of health. School's a very important facility in the community. We invest money in that. We see all kinds of opportunities with school playgrounds, for joint use agreements, other things like that. So we're looking at the school as a really important place to start. So because we're working with the University of Texas, and they were in the national research trial for the CATCH program, the Coordinated Approach to Child Health, we wanted to use that program as our baseline or usual intervention. Texas legislature requires that elementary schools have a coordinated school health. Sometimes that's in name only, and sometimes it's well implemented. And so we were building on CATCH as sort of an environmental model in the school and looking at a couple of extension programs that had promising data, but they'd never been in a randomized controlled trial. We've collected evaluation data on junior master gardener. We had a couple of masters, one PhD, that looked at the effect of doing the junior gardener program with elementary school kids and looking at their increased interest in vegetables. We even had, one study that reported that they had increased consumption, but the measures were not very sound, or they were not at the level that we wanted. So we're starting with a curriculum that is mainly a classroom lesson curriculum. Junior Master Gardener didn't require a garden to be part of that intervention, and so we added a garden. We thought about all of the things that literature told us, especially building on social cognitive theory and really looking at how behavior change, particularly in less resource families, might take place. small steps. So we added some gardens. The kids are growing 12 vegetables. They're tasting these vegetables raw. They're having these vegetables prepared in really pretty simple recipes. And I'm going to just share a little recipe card. Chad Wooten from Texas A&M, who is helping us really promote our university, is here to share some of those recipe cards with you. But we had tastings done, and it varied. Some of the kids really were involved in the tastings. Others, the demonstrator, did the demonstration, used the kitchen math lessons, and the kids got to see it, but they all got to taste it. We developed take-home recipes. We had kid videos where kids were preparing the vegetables from basically the raw state in the store or in the garden, taking it right down to a snack size, as well as how you store it in your refrigerator. We linked to these Dinner Tonight, which are adult-oriented recipes, and we linked to those. And then we wrote take-home family stories. We really were trying to integrate small behavior changes around our core behaviors, and I'll mention that just in a little bit. We did all the things that were going home in English and Spanish. Our second intervention was Walk Across Texas. This is a program that's been around in Texas since the 90s. It is a free program. It is available through a website. If you just Google Walk Across Texas, you can get to the website. We have a database that allows teams of 8, so using social support, teams of 8, and teachers can enroll their entire classroom so they can have all their kids enrolled. But we added some features. We've always had classroom activity breaks related to subject matter, but we added some things, walking bingo game for the family, newsletters in English and Spanish, and more activity breaks for the classroom. So we're basically looking at these 3 programs, 1 evidence-based and 2 promising programs. We're focused on 12 behaviors. So you can see, I'm not going to read it to you, but the main child behaviors, the main adult behaviors, and the main child-parent interaction behaviors were all focused around food, physical activity, and some interface with the garden, as well as meals eaten at home together. So our methods, we're using a pre-post study design with a control group, so a randomized controlled trial with 4 treatment groups. We're working in different sites with school districts. So in each school district, we have at least 4 schools per cohort, and we're aiming for 1,600 student-parent pairs, and we haven't quite met the halfway mark in our first cohort with 734 kids and 405 parents, but that's not bad. And so I think our statistician planned for us to have some attrition for sure. But you can see the treatments: catch alone, catch plus the walking, catch plus the gardening, and catch plus both the walking and the gardening. And we're doing this intervention in 3rd grade. So instrumentation, we have student surveys. We're using a vegetable PowerPoint because a lot of times kids don't even know what the vegetables look like, so that we're showing raw vegetables and vegetables cooked in a couple of different forms. We have a parent survey. Student surveys administered 4 times over 2 years, the parent survey 3 times over 2 years, child BMI and body composition using the Tanita scale. We have teacher surveys and interviews, volunteer surveys in English and Spanish. Did I mention that we're trying to work with master gardeners and master wellness volunteers as part of our delivery system? Extension agents, our county agents, are part of implementation, but we really wanted them to work with volunteers. Then we interview school administration staff, and as you've heard a little bit about SNAP education in an earlier presentation, we are actually collecting from teachers a time activity log on a 6-month basis, so they fill this out every month. And we're tracking the time and the lessons that they actually implemented in their classroom, the time they spend in the garden, if they're in the garden group, whether they use and implement the variety of activities involved in any of the interventions. And so that is forming basically our implementation fidelity research strategy, as well as the interviews. So let's look at cohort 1. We have a pretty good breakdown. You can see third graders. We thought we would have a smaller number of classrooms, but we ended up with lots of classrooms. But it's about even male and female. You can see we're predominantly Hispanic or Latino, but we have a pretty good percentage of African American students as well as Anglo students, a lot of Asian students and immigrant Asian students in our Houston area. And then if you look at the intervention condition, we're fairly equally spread out across that. So we're talking about our implementation year, which was 2012-2013, and we've just collected the last round of parent data and child data this past spring. You can see our full programs, 14 weeks of the junior gardener, 16 weeks, 8 in the fall, 8 in the spring for the walking program. And the catch coordination kit was used and developed as an intervention. In reality, we had hoped that catch would be the usual treatment, but when we went in, we found that lots of schools hadn't even been trained on catch, and some of them, even though they'd been trained, their catch advocate had left and they were dormant. And so we had to kind of do a booster training with this coordination kit. So they didn't get a full intervention training on that. But let's look at some preliminary results. And these are related to student-reported outcomes on the child survey. So we did okay across almost all our groups on choosing fruit juice over soda. That's a little better. Water would have been better. We got a huge percentage change in our pilot, like 20%. So we weren't so pleased with this. But look at the parents teaching their kids and being involved with sport at some level. Outdoors, that was a trend, but I think it's an important trend. Getting kids outside and being outside with your parent is another really important way to see engagement and to determine if we're making some difference. Because there's recently been some research that's looked at playgrounds and school recess areas that have a garden, and you see a greater increase in physical activity than when you don't have a garden. So kids are very curious about the outside. We increased moderate and vigorous, both moderate and vigorous daily physical activity went up, and it went up in our combined treatment school the most, so we were pleased with that. And when we looked at indoor sedentary time, that went down as well, and it went down as well in our combined treatment, which is really what we're predicting is going to have the best effects. Increased vegetable exposure, you'd expect that, and increased preference. I think that's really what we want to see. So student BMI, not so positive, but again, look at where we're starting in terms of percent of population that's obese. So we're starting at the very high end with, in some of our treatments, 40% of the kids are obese and 49% are at the 85th percentile. So not as much change, but we didn't gain too much weight. So some of the key factors that we're seeing in terms of looking at vegetable preference and consumption by intervention, improved self-efficacy, consumption of sweetened beverages went down a little bit. Healthy family meal practices. That's, families preparing things together, doing things together, positive trends. Knowledge, significant improvement, that would be expected. But then let's look at the parents, because I think there's some interesting things with the parents, and then I want us to look at some of the things that actually reached into the home, and that's really where I think we can see we're beginning to make a difference. So parental, age, marital status, language. Surprisingly, only 22% speak Spanish in the home, so that says something about acculturation. You saw that most of the people responding are the mothers of the children. But the age range, again, this may reflect what you saw presented earlier, a little older parent or grandparents raising grandchildren. So we probably had some grandparent caretakers filling this out. But when we look at education, employment, benefits, and food security status in this sample, we see lots, a good percentage working full or part-time. A smaller percentage, but 30% working, not working outside the home, some retired. Education, a lot, high school or less, very much what one would expect. WIC and SNAP participation, pretty high percentage there. Free and reduced lunch, one would expect we're in Title I schools, almost 80%. And then when you look at our food security questions that looked at running out of food towards the end of the month, that is about 43, almost 44% are food insecure. So I think that's a very important issue. Then we look at changes in parental behaviors related to child eating, encouraging vegetable consumption, and the interaction, just feeling that you can have a conversation about healthy eating and that you're equipped to do that. And so again, you look at where we got significant change between pre and post. Very positive in our, in really all of our treatment groups. So I think that's important for us to see. Now, I will have to say that you would say our walking program, well, why would your walking program have this kind of influence? But in fact, the newsletters that went home did contain information about healthy eating. So that's something that we need to look more closely at as well. Other preliminary data is looking at activity in our WAT-only treatment. We got a better outcome from pre to post than we did in our others. So we're going to be looking very deeply at implementation and what really happened in terms of actual implementation in the different treatment groups across sites. So this may be a little hard to read, and let me try to use the pointer on this because I think this is one of the interesting things. In our post-parent survey, we had a final page that really looked at what components actually parents learned about, had some experience with, and what did they do. And so if you know anything about cooperative extension, we originally started with county agents out there trying to take research from the university to the people. And we were mainly working in agriculture, and we eventually began to work with families. But the ag producers didn't want to do what our ag agents were encouraging them to do, to increase production. So the ag agents, pretty smart guy, or two or three, said, all right, we'll start with the kids. And they started corn and tomato clubs. And they found that when the kids did demonstrations, their parents came and they saw the increased yield, and they were more likely to adopt. And so we're trying to reach into the home in a similar way. And I think this really demonstrates that we've done quite well, despite all the losing of things in book bags. So let's see. So the material's pretty high. Attended events, not as high as we'd like. Learning about the catch lessons. Well, they learned more in the intervention groups than they did in the catch alone, even though those schools had received training. Again, catch materials could go home from all the schools. Go slow and WO foods, big concept in catch, and one that we integrated throughout our materials. And if you look at the WO Slow and Go parental reach on that, it just gets better. So that's important. Look at the talking about the school garden. Gardens were a really big hit. A lot of kids hadn't been exposed to gardens or to growing food. And this is a great way to teach science and math, as well as get kids interested in healthy eating. Building the garden at school, not as many as we'd want. Did you read the vegetable recipe? So 60% and 50% in treatments with the junior gardener that got the recipes, read those recipes, and then 20%, let's see. Did you try the veggie recipe? So 30% and 26%. That's pretty good, isn't it? To actually try a vegetable recipe. And then some of them went to the Dinner Tonight site, and they could pull down recipes, download them, and use them, and they were taught how to actually prepare the foods. We found cooking skills are major lacking. Our nutritional sociologists told that. And then bonus miles, reading the family stories together was not as much as we wanted because we were really working on a lot of messaging there. Playing bingo, a little less. But I think it's interesting to think about what we actually got moving home. And then finally, we really saw that our combined intervention was effective. And we're looking more deeply now at implementation data to help us look at the strength of dosage across the various treatments that we were working with. You know, some of our intervention components reached home. There are mixed effects in the obesity changes. And then, again, we're tracking fidelity very closely. So we're looking at paired child analysis next. And we'll take some questions. I'll thank all the kids that did the gardens for that.
Hello again. Thank you, Dr. Warren. I did have a question of whether or not you assessed in the parental involvement if parents initiated or developed gardens at home as a result of the program.
Yes, we did ask that question. We have only analyzed the nutritional and physical activity behaviors at this point. The data was just being crunched. Literally, I got my data last week. So we're still looking at that. I think that will be interesting. Our family stories really take a trajectory of working with a family role modeling, family with a grandmother that has a little gardening experience. So we've role modeled in our stories how you can just have a garden in a pot, or you can find a vacant lot or somebody nearby. So we've tried to role model some ways that could happen, and I think it'll be interesting to see that. That would be a big outcome, because that's a big stretch for a lot of people, is having a garden. Any other questions? Well, thank you very much.